Imagine undergoing brain surgery with only wine to dull the pain. This was the reality for ancient Egyptians. They faced illness and injury with a combination of pragmatism, spirituality, and surprisingly advanced medical knowledge. Their surgical skills, developed over millennia, were ahead of their time. We know this from the tools they used and the evidence left behind on mummies. Egyptians believed that illness was caused by evil spirits or the wrath of the gods. But they also understood the practicalities of treating wounds and setting bones. Their doctors, often priests trained in the art of healing, developed a range of surgical techniques that were innovative for their time. They performed complex procedures, from setting fractures to removing tumors, all without the benefit of modern anesthesia or antibiotics. Ancient Egyptian surgical instruments, many discovered in archaeological digs, reveal their advanced understanding of anatomy and surgical techniques. They used bronze scalpels, bone saws, and forceps, tools that wouldn't look out of place in a modern medical museum. One particularly intriguing instrument was the Hook of Horus. This hooked instrument, named after the falcon-headed god of healing, was used to remove cataracts. They also developed drills to bore holes in the skull, a practice known as trepanation, believed to release evil spirits or relieve pressure on the brain. While the efficacy of some of these procedures is debatable, the sophistication of the instruments themselves is undeniable. The lack of anesthesia posed a significant challenge for Egyptian surgeons and their patients. Pain management relied on natural remedies. Alcohol, opium, and even vinegar were used to dull the senses. Patients may have been hypnotized or restrained during procedures. Infection, a constant threat, was combated with honey, copper, and plant-based antiseptics. Egyptian doctors understood the importance of cleanliness. They sterilized their instruments with fire and used clean linen bandages. Despite their best efforts, many patients succumbed to infection. A testament to the ever-present dangers of surgery in the ancient world. Section 4. Successes etched in bone, evidence of advanced ancient Egyptian surgery. Despite the limitations of their time, Egyptian doctors achieved remarkable surgical successes. Evidence of their skill is etched into the bones of mummies. Healed fractures set with splints and bandages demonstrate their orthopedic knowledge. Skulls show signs of successful trepanation, with evidence of bone regrowth indicating that the patient survived the procedure. These successful surgeries were not isolated incidents. Ancient Egyptian medical papyri, such as the Edwin Smith papyrus, provide detailed descriptions of surgical procedures, demonstrating a systematic approach to medicine. These texts, written thousands of years ago, remain a testament to the ingenuity and skill of ancient Egyptian surgeons. Section 5. Shadows in the sand, questionable practices and their consequences. Not all ancient Egyptian medical practices were effective. Some were based on superstition rather than science. Amulets and charms were often used alongside practical treatments. Some remedies, like using animal dung to treat wounds, likely did more harm than good. The line between magic and medicine was often blurred. While some practices were ineffective, others were downright dangerous. For example, there is evidence that Egyptians attempted to treat eye infections with lead-based makeup, which likely exacerbated the problem. These practices highlight the limitations of ancient medicine and the constant struggle to understand the human body. Section 6. The enduring legacy: how ancient Egypt shaped modern medicine. The influence of ancient Egyptian medicine extends far beyond the sands of time. Their systematic approach to documenting medical knowledge, evident in their papyri, laid the foundation for medical texts for centuries to come. The Greeks and Romans borrowed heavily from Egyptian medical practices, disseminating their knowledge throughout Europe. While many ancient Egyptian medical practices have been superseded by modern medicine, their emphasis on observation, diagnosis, and treatment laid the groundwork for the scientific approach to medicine. The legacy of these ancient healers lives on in our hospitals and research labs. Section 7. From Papyrus to Progress, a continuous thread of innovation. The story of ancient Egyptian medicine is a testament to human ingenuity in the face of adversity. Limited by their technology, they achieved remarkable feats of surgery and developed a sophisticated understanding of the human body. Their successes and failures remind us that medicine is a constantly evolving field, always striving for progress. As we marvel at the achievements of modern medicine, we should remember the debt we owe to those ancient healers who, with their bronze tools and unwavering determination, first dared to heal the human body. Their story is a reminder that the pursuit of medical knowledge is a continuous thread, connecting us across millennia.